Hello, I'm Dr. Praveen Ravishankaran, a robotic cancer surgeon in the beautiful city of Coimbatore with a special interest in advanced minimally invasive cancer care. Over the years, I've had the privilege of treating patients across a wide spectrum of cancers using cutting-edge technologies like laparoscopy and robotic surgery. My work is focused not just on removing cancers, but on doing it with precision, minimal pain, and faster recovery and better quality of life for my patients. Every surgery I perform is a balance between science, technology, and compassion because behind every diagnosis is a person, a family, and a story. Through this platform, the Wellness Oracle, my goal is to simplify complex cancer care and bring clarity, awareness, and confidence to people who need it the most. Today, I want to talk about a group of cancers unlike almost any other, not because they are the most common, but because of who they tend to strike and how completely they upend a life without any warmth. Bone tumors and soft tissue sarcomas. Before we get into that, let me show you something from your kitchen. Stir a pinch of turmeric into the water. A warm, healthy golden yellow color forms. Now add a few drops of detergent. Watch it shift to a deep reddish brown, slowly, silently, without any external signs. The chemistry of the solution has been disrupted from within. Now add lemon juice. The color begins to shift back towards yellow. But here is the key question. What if there were no lemon juice available? What if the only option, once the chemistry has shifted, was to remove the affected part of the glass entirely and rebuild with a new structure? This is the story of sarcoma surgery. This is also the story of why reaching us early before the color has set changes everything. Hold on to that thought. Many of you would have seen the Hollywood film 50-50, starring Joseph Gordon-Levitt as a healthy, non-smoking 27-year-old who leads a completely ordinary life, but is suddenly told that he has a 50% chance of surviving a rare malignant tumor of the spine, a soft tissue sarcoma. The film was written by Will Reeser, based on his own real experience as a young man with spinal cancer. What I want you to take from this is not fear, it is the honesty. Sarcoma can arrive in anyone. The difference between Reeser's story, which ends in remission, and the one that does not, often comes down to reaching the specialist center quickly enough. Bone and soft tissue sarcoma arises from the body's structural tissue: bone, cartilage, muscle, fat, nerves, and connective tissue. The most common primary bone sarcoma is osteosarcoma, arising almost often around the knee in adolescents aged 10 to 20 years, and eating sarcoma, which strikes even younger and is among the most aggressive bone cancers we know. Soft tissue sarcoma spans over 100 subtypes, including liposarcoma, leiomyosarcoma, synovial sarcoma, rhabdomyosarcoma in children, and GIST or gastrointestinal stromal sarcoma, which has its own remarkable treatment story. Over 80% of bone sarcoma patients at the Indian centers fall between 11 and 30 years of age. Warning signs include persistent bone pain around the knee, thigh, or upper arm that does not settle after 2 weeks of rest, especially in a child or teenager, a firm growing lump deep inside the limb, or a pathological fracture, a bone that breaks from a trivial fall. Any soft tissue lump deeper than the skin, larger than 5 centimeters or growing, regardless of whether it hurts, must be evaluated at a specialist oncology center without any delay. The way the biopsy is placed determines the surgical outcome. An improperly placed biopsy at a non-specialist center can convert a limb salvageable tumor into one requiring amputation. Treatment for osteosarcoma and healing sarcoma always begins with chemotherapy before surgery to shrink the tumor and test its biological response. The degree of tumor death on the resected specimen after chemotherapy is one of the most powerful predictors of long-term survival. Today, over 80 to 90% of patients with localized osteosarcoma undergo limb salvage surgery. The tumor or the cancer is removed with wide, clear margins, while the limb is preserved and reconstructed with a prosthesis. A 2025 study confirmed limb salvage achieves a superior 5-year survival rate compared to amputation, 83.8% versus 62.5%. Saving the limb and saving the life goes together. For GIST, the targeted drug imatinib has transformed a once fatal disease into one that can be controlled for a decade on a daily tablet. Back to our experiment, the detergent represents the genetic mutation that disrupts the cellular chemistry of the bone or the soft tissue, slowly, silently shifting the environment from a healthy golden towards a red color. The shift has no pain, no fever, no external announcement. It simply happens molecule by molecule until a swelling appears or the bone breaks. The lemon juice is the chemotherapy shifting the chemistry back, shrinking the tumor, buying the surgeon the condition needed for limb-preserving operation. Together, the lemon and the surgeon's precision give back what the detergent has quietly taken away. But the window to use the lemon juice most effectively before the chemistry sets permanently is exactly why early specialist referral is the most important intervention in all of sarcoma care. If a child or younger person in the family has unexplained bone pain lasting for more than 2 weeks, a growing lump deep in your limb, or a fracture from a minor fall, please seek evaluation at a specialist center immediately. Please do not let distance or the hope that it will resolve stand between a young person and the care that should be given to save their limb and their life. So I urge you, share this with parents of young children and teenagers. For sarcoma, early specialist referral is everything. Subscribe to the Wellness Oracle for more clear, practical, and evidence-based insights into cancer care. Stay informed, stay strong, and I'll see you in the next video where we continue this journey of understanding and fighting cancer together. Thank you and have a nice day ahead.